in response to which populations are resisting for which reasons, I'm telling you, I have family members in Western Maryland who are not interested in getting the vaccine, and I've talked to them blue in the face. I have family members on the West Coast, and it's gotten to be a family tense issue because there is some mindset out there in many people that this is not safe. There's not enough information, and so I think it's continuous good information coming forward to be able to promote understanding that it's really important to be vaccinated. So I would just say we're going to continue to need resources in our areas, particularly the rural areas, to be able to continue to educate and persuade people that this is absolutely essential to get the vaccine.
I live in an area where I'm debating with people regularly, even the validity of the vaccine. And I haven't figured out what kind of accurate information I can give people any more than I already have. And that leads me to, I guess, my bigger question, that with so many people who are working in healthcare facilities who are unvaccinated, including a lot of upper level professionals who are very outspoken about the validity of the vaccine and the illness. It's taking so long for those things to happen. I've even been trying to get community health workers to be able to be indigenous and get out there, and I am stuck with access to programs to be able to get those workers who are available, but get them up and get them through a program and then get the kind of funding. We have workforce investment money that's sitting, and our locals are not using that to be able to address the need. And so I'm concerned, and I'm a little pushy because the cases and the positives are continuing when we're trying to make some efforts to change that, but it's very frustrating when you just don't have the availability of folks in the pipeline to be able to provide the services. But whatever you can do to expedite that, and I would suggest to you, somehow get that accurate information to our businesses, get it down through the chambers, get it out there, because it's a lot in the business community who just are listening to other voices and are discrediting very verbally all that we're trying to do. Thank you. Thank you, Mr. President. Thank you. Thank you very much. Thank you, Secretary Schrader, and everybody for your good questions. I have a couple just to follow up on, then I have some more substantive ones. The studies on immunity, I think, are really, really important, because that's one of the things that I'm hearing, in addition to, well, it's people who are vaccinated who are getting sick, as well as those who are unvaccinated. So I think any information that we can get out on what we know about immunity is really important. The other issue has to do with, are you getting pushback from parents through the school systems who do not believe their young children should be vaccinated? Unfortunately, we have some folks in our area, elected and otherwise, who are suggesting that if you get your kids vaccinated, you are merely throwing your kids to experimentation. So my question is, I hope we're getting good, sound information out there to parents to combat that. Because I mean, it's pretty rampant down where I am. And in addition to that, I am just appalled at the number of health professionals who are pushing back on this as well. And to me, it's just basic safety. And I can't tell you, every week I hear from health professionals on this, on why am I expected to be vaccinated and what are you going to do about it? Well, they get a heavy letter from me, so
grounded in the research and the facts that are coming down through the CDC and through even our local physicians on the ground. And that's what's important. We have pushed back as Assure on the mask mandate and on vaccines mandate because we believe that folks can get the information they need and make reasonable, good, sound decisions that benefit themselves and the community. And so we pride ourselves on making sure that folks have good information and trust that they are going to make good decisions. I have to fight in that Senate vaccine committee every time we meet against a mandate because the Western Shore folks would like nothing, and all of our folks who are Johns Hopkins public health officials who are also legislators believe this should have been mandated right out of the gate, that everybody should be vaccinated. And we're trying to hold off on that. I mean, the issue is, if you don't get most of the people vaccinated, you don't get immunity and you interrupt the virus's course. And that's the information that needs to get around so that folks do understand immunity and do understand the importance and significance of vaccination. I mean, and we've done this years ago we expect kids to come to school vaccinated. And that's kept us from having outbreaks of polio, chickenpox, we get occasional measles, mumps, whooping cough. You get some of that out and around, but because most people get immunized, with all this pushback on not immunizing, we're seeing an increase in kids not being immunized, which is only going to aggravate infections in the community going forward.
So what is the process in the public school to mandate a vaccine? Is there a process legislatively that you need to go through to mandate kids to be vaccinated for something?
Well, it's just a given. I think it's going to become part of the routine with all the other immunizations that you have to be able to come to school.